says, and it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, my friends from South Florida and all around the country. It's nice to be back after a short vacation. And listen, I hope you all had a wonderful, wonderful Thanksgiving. We have a fabulous guest today. When I tell you fabulous, unbelievable. I looked at his resume. I kept reading it and reading and reading. I couldn't believe all the accolades I can say about this gentleman. We have Dr. Brandon Shallop. He's an orthopedic surgeon. And guess what? He's a Michigan grad. Go Blue. Go Blue. Right, and he won his national championship. Doc, tell us a little bit about your education.
So my education, I grew up in Michigan originally, as you kind of alluded to. So I grew up in the suburbs of Detroit. I grew up in a little town called Commerce Township, which is about 45 minutes or so northwest of Detroit. And then went on to University of Michigan, where I did my undergrad training for 4 years. And now I'm absolute diehard, University of Michigan fan. So the fact that they just won the Big Ten championship has been a long time coming. So I'm pretty excited about that. And then the fact that they're going to be playing in the Orange Bowl here in Miami, so you bet I will be there. Oh, okay. I will not miss it. So.
Go Blue.
And then I went on to Philadelphia. So I spent 9 years in Philadelphia doing my medical training. So I went to Jefferson Medical College, which is one of the more older historic colleges in Philadelphia, or in the country really for medical school. And then I stayed in Philadelphia and did a 5-year orthopedic surgery residency at Drexel University. Then I went on to an extra year specialized training in my fellowship in sports medicine, which really kind of encompassed more of the arthroscopy training, which is more the camera training at the University of Miami down in Coral Gables. And then I've been up here practicing for almost my second year now.
And guess what? I guess you're with the orthopedic group out of Lake Worth area?
Yeah, so I'm part of the Orthopedic Center of Palm Beach County. We're a large multi-specialty orthopedic surgery practice, which includes orthopedic surgeons, podiatrists, as well as pain management. We have 3 offices kind of encompassing all of Palm Beach County. We have an office in Boynton Beach, an office in Lake Worth, and an office in Wellington. So we kind of have a nice triangular area we kind of help facilitate patient care.
I'm going to give you those phone numbers, and I'm going to give you their addresses. So and by the way, I want to start off giving you his website, because you really got to go to his website, because you have to look at this man's resume. I always say people are going to tell me, I'm going back to Boston for surgery because they got the best doctors. I'm going back to New York. I'm going back to Chicago. Well, guess what? I don't think you're going to find a better orthopedic surgeon with this man's background, and as young as he is, you're not going to find a better orthopedic surgeon if you go to Boston, New York, Chicago, Las Vegas, wherever you go.
Well, I appreciate that.
This man is unbelievable. So go to his website. It's www.ocpbc.com. That's www.ocpbc.com. His office in Lake Worth is at John Kennedy Drive. I'll give you his phone number. Take this phone number down, please, 561-967-6500. That's Lake Worth. If you're in the Boynton Beach area, 561-967-6500. If you're in the Wellington area where I live, take his phone number, 561-967-6500. And he has I visited his Wellington office a number of times. He's got a great staff of doctors there. He works with a tremendous staff of doctors. And if you have other problems that he can't handle, I'm sure you can refer them to some, right?
I mean,
Don?
absolutely. That's the nice part about being, part of a large multi-specialty practice. We have specialists in every facet of orthopedic surgery, so it allows us to kind of, really treat the patient holistically and keep us within the group, and it kind of coordinates care, and we can discuss, patient care amongst colleagues and within the office. And I think it's been a really good experience for patients, kind of being able to see all their musculoskeletal conditions and care.
One of the things a couple of things he specializes in is really knees and shoulders.
Correct.
And what do you see when you're doing knees? And I understand there's a number of people, as they get older, they want to play golf. They have knee, and they don't want to go for the surgery. They're afraid of the surgery. But sometimes can you do a partial reconstruction or a full reconstruction?
Well, I think there's multiple facets we can kind of treat musculoskeletal injuries. I mean, number one, I think a lot of times, non-operative management is often overlooked, and I think I take that really wholeheartedly in my practice. The old saying I say in the office, no one dies from knee arthritis. It's not a life-threatening problem, but it becomes a quality of life-threatening issue if you can't do the things you want to do. So we start intervening on different things. There's a whole host of things we have in our office. Number one, we have physical therapy. I think it goes a long way working on strengthening the muscles and joints around your body, and body maintenance as we get older is probably one of the most important things that we overlook often. Simple things and simple remedies such as icing and oral anti-inflammatories, a whole host of medications that have been that have improved over time that help facilitate musculoskeletal care and helping pain and inflammation, the result of kind of the wear and tear of life. In addition, we have injections, or again, procedural things. There's kind of the classic cortisone injection, which everybody talks about, which is a very common tool. Think about it, and I use analogies all the time in the office with patients. Think about it, instead of taking a Motrin and hoping it finds your knee, we're putting an anti-inflammatory in the knee. It's a more direct approach to patient care, and I think it helps facilitate healing process.
And how long does that usually last for the patient?
It's a little bit variable by patient, but from a safety standpoint, without causing major side effects, we usually like to wait 3 to 4 months before repeating those injections. But it all comes down to seeing how effective they are for that individual patient. There's other injections as well. I mean, there's more and more advancements in some of the other medications as we inject into different parts of the body. The one that people have heard about is called the gel injections. That really what that medication is hyaluronic acid, which is kind of like a water molecule. And we inject into different joints, and what it helps do is help lubricate kind of the roughened surfaces of kind of more wear and tear or arthritis to help mitigate pain and inflammation as a result of people still staying active and playing sports throughout their entire life. And then the other thing that's more modern is PRP. I'm sure that's kind of been tossed around a little bit too, which stands for platelet-rich plasma. There's multiple facets that people are using in many different areas of medicine, but in the orthopedic world, there's a lot more data coming out that it makes a big difference for arthritic conditions as well as degenerative changes as well as tendonitis and all those different things. So we use those all in our office to help facilitate patients before we even talk about doing surgical management.
So when should a patient really know when it's time to come to see you?
We're happy to see it any time. I mean, if you have an ache and pain in any part of your body, we're going to have the right specialist to help you. For me specifically, I really focus probably 90 to 95% of my practice on knee and shoulder injuries. And I have patients who don't really have an injury at all. They just come in saying, "Hey, all of a sudden my shoulder hurts, or all of a sudden my knee hurts." We're here to help you. We're more in the quality of life giving, facet of medicine. And I keep using that with patients all the time. So we're here to help you. I mean, you may not be healthy and not have any active medical problems per se, but if you can't golf, you can't play pickleball, you can't jog, you can't run, you can't surf, you can't bike. I mean, that's what we're here to help you with.
And how long does it take, Doc, after the surgery? People tell me, it takes a year, it takes 2 years, it takes 6 months. How long does it take to really heal where you think you can get back to activity?
That's a great question. So I think it's obviously several little details that are specific to that. Obviously, patient age, patient activity level, the type of surgery we're doing. There are some surgeries that, with my specialty practice being in sports medicine, we do more minimally invasive. So the arthroscopy training, which is really the camera surgeries, has really accelerated the healing process because historically we'd have to be large open surgeries. Now we can do it all through small little focal incisions using the cameras. So the recovery process is definitely much faster in some of these more minimally invasive approaches that we're doing.
So that's amazing. So you don't have to spend 2 years recuperating of rehab and stuff. And one thing I've talked to a number of your rehab people, and one of the things they tell me is that the doc's outcome, Dr. Brandon's outcome, is just amazing. Dr. Shallop's outcome is just amazing when he has great outcomes. I mean, that means when he's doing the surgery, after he puts you in therapy, the therapist will tell you that his outcomes are fantastic and the patient seems to be healing a lot faster. I guess what? I guess that's part of his education, being young.
I appreciate the feedback.
And knowing what he's knowing. That's where I want to go. So the one thing that impressed me a lot is when Dr. Shallop first realized he wanted to be an orthopedic surgeon, he did a lot of things. And one of the things he did when he was in college, I think you were in college, you were an MA.
I was.
A medical assistant. Imagine this. So all you medical assistants that are out there, here's a perfect gentleman that can tell you, a doctor, he started as an MA, and now guess what he is? He's an orthopedic surgeon, went to the best of schools. So MAs, you can start as an MA, You go to nursing school. You go to become a physician. And that depressed me when you became an MA.
No, I appreciate that. I think it was kind of the foundation groundwork for my medical education. It kind of helped me get involved in the medical field early on, learning basic skill sets from patient intake and history and vitals. And, it was only the absolute foundation for my medical education, kind of helped me drive towards that next step.
And some of the things when you do knee surgery, you do knee arthroscopy, reconstruction, PCL reconstruction. Now, I know a lot of people have this one, a meniscus tear. This happens frequently.
Every day I see meniscus.
And people say, well, I got to get my meniscus fixed. How do you get your meniscus fixed?
So there's different ways of treating meniscus, right? So we don't lump, I think a lot of people lump meniscus tears into all the same thing. I think the term meniscus tear is like the word soda. And underneath that you have Coke and Pepsi and Diet Coke. There's a million different types of meniscus tears. So there's acute traumatic meniscus tears, like boom, fell, tore my meniscus, versus more of the wear and tear, kind of like what we call degenerative meniscus tears. Those are treated totally differently. So again, the degenerative tears that are non-injury related are usually kind of treated conservatively, physical therapy, injections, anti-inflammatories. While the more acute traumatic tears, there's two different ways we treat them. Number one, they're all the gold standard at this point is minimally invasive surgery, which is knee arthroscopy. Again, going in 2 tiny little poke hole incisions with the cameras and doing one of 2 things. Number one, looking at the integrity of the tissue itself. Is it fixable or is it not fixable? And depends. There's multiple different details we look into that, but fixable injuries we try to fix them. We try to repair the meniscus, do a meniscal repair, and we do that with different little sutures and different little tools we use to try to fix the meniscus. And again, that's based on activity level and patient age and et cetera. But again, the meniscus has a function, and I think that often gets overlooked. A lot of people historically just went in there and took the meniscus out. People used to think historically that the meniscus was more of like a vestigial structure and had no function. It really functions as a shock absorber in the knee. It lives between the thigh bone and the shin bone and helps offload cartilage. So in my hands, I'm more aggressive about fixing meniscus than I would say probably majority of people are, because it has a function, and if we take it all out, that leads to arthritis in the future. We know that. That's a known standard now. That being said, there are some meniscus tears that are not fixable, despite what happens. So what we do is what's called a partial meniscectomy, which means debriding the meniscus down to a stable rim, but leaving as much meniscus as possible.
Okay, now let me ask you another question. When you basically fixing these, there's ACLs, all kind of different ailments they get from sports, especially
Absolutely.
sports, especially young kids that are playing football today, hockey. Now, what is, I hear ACL reconstruction. I see a lot of football players.
Very common.
I got my ACL. What's ACL?
So ACL stands for anterior cruciate ligament. It is one of the 4 ligaments within the knee. That's why I use ACL. It's much easier to toss that term around than to use the anterior cruciate ligament. But it's one of the most important ligaments within the knee. It helps provide stabilization to the knee joint. Basically, it prevents what we call anterior translation. What that means is it prevents the shin bone sliding forward from the knee bone. It is probably one of the most common injuries we see in athletic individuals in cutting and pivoting sports. So football, basketball, soccer, those are the top three that we see it in. And I'm sure if you watch football or NFL, it's a weekly basis.
Every day.
It's a very common injury. So we're trying to work on the science behind about trying to more ACL prevention, but still the gold standard is once you tear your ACL, it doesn't heal. That's the problem. So there's no role for really non-operative management and otherwise active individuals. So what we do is we go in there and we make a new ACL. We don't go in there and sew the old one back together. So the standard of care is an ACL reconstruction, meaning making you a new ligament. There's kind of 2 ways of doing that. There's using tissue from your own knee, or what we call autograft tissue, or there's taking tissue from a cadaver or dead person tissue to reconstruct that ligament. There's a whole host of ways we can talk about that, but historically for active, healthy individuals, the gold standard is using your own tissue. It's live, living cells.
Now, listen, a lot of us seniors, I'm a senior, we want to continue to play golf, and you want to play golf, and all of a sudden the knee pain just hurts so much, you say to yourself, okay, is a knee brace usually helpful? I see a lot of people knee braces. I wore a knee brace, that sort of got worse.
That's a great point. So I get that question all the time in the office, and I think it depends on what type of brace you're using. I think it depends on how you're trying to use the brace. All right, there are big cumbersome braces that actually slow people down and put them at higher risk for injury, actually. So it's not every single brace you want to be using. I think for active individuals who don't have any true injuries to the knee, like ligament instability, a little neoprene sleeve goes a long way. It provides compression, a little bit of support around the knee. I'm a huge advocate for that. And then patients who are playing more cutting, pivoting sports, tennis, pickleball, basketball, football, a little bit of a hinge knee brace can provide some support for patients.
The other thing I was always concerned about is when a person has, like I had a knee injury, does their equilibrium sort of the balance affects their balance?
Well, I think it can a little bit, because what happens is subconsciously when things hurt, we start favoring the leg. What happens is you start offloading to the other side and you start throwing your hip and your back, and it's like head, shoulders, knees, and toes. We're all connected. So if you have an injury to one part of your body, it's important that you rehab that appropriately, or at least get it evaluated and treated, so you don't start getting ailments in other parts of the musculoskeletal system.
And one of the other common injuries for sports folks, especially if you're young enough, I know my son was playing baseball, he got Tommy John. Explain to me about shoulder surgery. What type of injuries can occur in the shoulders?
So it's a great question. So shoulder surgery is a little bit different than obviously the knee and then the elbow, like you were referring to with the Tommy John surgery. But shoulder surgery, there's a whole facet of different things that can happen in the shoulder. The most common thing that I'm seeing here in my practice currently is rotator cuff injuries, which is a very common injury as part of the aging process, but also can be a traumatic mechanism as well. Patients who fall on their shoulder or just the repetitive overuse of life can tear the rotator cuff. The rotator cuff is a series of muscles around our shoulder that kind of give us that full dexterity of the shoulder joint. And when a tendon tears, it doesn't really, again, kind of in the knee, doesn't heal itself. So the standard of care sometimes is to go in there and fix that. And again, we do that now minimally invasive with the cameras to help us accelerate recovery.
Doc, these 15 minutes went by, so we're going to do a little commercial, then we'll be right back.
This is great. Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer Ipv Therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Instagram and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks. Again, we have Dr. Brandon Shallop, MD, orthopedic surgeon, an amazing young man, handsome as can be, big Blue fan. Sorry, ladies, he's married. And by the way, he's with Orthopedic Center of Palm Beach County. And there's a number of doctors there. And I said that he's got an office. I'm going to go back to that again. He has an office in Palm Beach, in Lake Worth. He has an office in Boynton Beach. He has an office in Wellington. Now, I want you to go to his website again, because there are a number of things on that website that you should see that he has on his resume that I can't go over because I don't have that much time. His Lake Worth office, his phone number again is 967-6500. As a matter of fact, you could call that number, 561-967-6500, and they'll answer and put you in any office, the closest one you want. Mm-hmm. Remember, this gentleman has a tremendous resume. And I told him, you got to put it all on his website. He's done a tremendous amount of publications, right, Doc? You did a tremendous amount of research. So you have a lot of publications. You've done a lot of research on this here. Now, have you ever worked with any major sport teams?
So I'm glad you asked that. So when I did my fellowship training down at the University of Miami, I was actually the head team physician or assistant team physician for the Miami Hurricanes for that entire year. So in the fall, I traveled with the Miami Hurricanes football team all season. So I was an intimate part of their team, taking care of a lot of their athletes. I'm sure you saw me run on the field a million times on ESPN, but it was a really, really cool experience where I got to travel and spend a lot of time with the team. I still have a lot of contacts down in Miami. I still talk with a lot of the players, as well as coaching staff, in addition to the other physicians at that time. While I was also down in Miami, I was also one of the co-assistant team physicians for the Miami Marlins. So I spent a lot of time with Major League Baseball. So I do a lot of baseball-related activities in my practice now with young, kind of youth baseball athletes. But I still have a lot of connections, in all facets and all hierarchies of baseball.
As a matter of fact, he was quite an athlete himself. 3 years in Michigan's golf team. Basketball, baseball?
It was more hobbies at this point. I mean, I was never big enough, fast enough, or strong enough to play professional sports, so I decided to take care of professional athletes instead.
Well,
That's the real answer.
Can you imagine? He could have been competing with Tiger Woods. He was a +2 handicap.
I wish. Now, my golf game has kind of deteriorated a little bit.
Well, that's all of us, okay?
Yeah, life's been catching up. I haven't been able to practice as much.
And, Doc, you're married and have a child?
I am. I have a lovely wife. My wife's name's Rachel. We have a young daughter whose name's Stella. She's 21 months old, and she's like my little doll.
She keeps you busy.
She is the best.
Now, why did you come to South Florida?
So my whole family's here in South Florida. That was kind of the thing. Like, again, growing up in Michigan, my family, my wife's family, they were snowbirds to South Florida, as if many people in the North are. But all my family has retired down in this area, so that was kind of the driving force for myself and my wife and my family to come move and start developing a practice here in this area, because our whole family's here. This is kind of our second home, and I'm here to stay.
You know, and he has a tremendous resume as far as the number of honors he's had. I'm looking at Jefferson Medical College clinical honors, orthopedic surgery, collective clerkship, high honors, urology.
I did a rotation, and I was actually thinking potentially neurology at some point, kind of diving into different parts of medicine when I was kind of going through my medical training.
Well, what made you orthopedic surgeon?
Better field. I think I enjoy working with musculoskeletal system better, and I'm more of a concrete thinker. It's problem fixing. I think that's what I like about orthopedic surgery. There's a broken this or a torn that. I can go in there and fix the problem. It's like a one and done.
He's like a Lego guy.
I literally, it's funny you say that. I was obsessed with Legos growing up. It was
Lego.
like my thing.
And you got a neurology clinic. You got family medicine, clerk psychiatric, diagnostic. So you've got it all.
I felt like I had good training.
How many orthopedics people can say they have all that? That's what. Now, let me ask you, if you're from Michigan, you're from Boston, you're from New York, where are you going to find a better resume if for a young man like this gentleman right here, if you have shoulder injury, and I know I deal with a lot of orthopedic people, but I was so impressed with this resume, especially when I see he was started as an MA. So he knew he wanted to be a doctor way back when.
I knew for a long time. I mean, not only being a medical assistant, my grandfather was a general surgeon, so I spent a lot of time with my grandfather growing up, and he was like my mentor before he passed away. And he was probably the biggest driving force to push me into medicine, to seeing what he could do and how he could take care of patients.
You know, the thing that impressed me as talking to Dr. Brandon is right now is his passion for what he does. He has tremendous passion for what he does. He takes this serious, and you know, another thing people fail to realize, Doc, is they don't understand between arthritis and the knee. Mm-hmm. Does arthritis affect the knee, or what? A lot of people say, "Well, I went to see a doctor." He said, "Well, you got arthritis in the knee."
Right.
What does that mean?
So arthritis is, again, a generic term we use for joint inflammation, the result of wear and tear. So what happens is, I use analogies all the time. I'm going to keep going back to them because I think they work and people understand them. Think about our joints like tires on a car. You take a car, drive it for 40, 50, 60, 70, 80 years, the tire treads start to wear out. That's just the natural history of us living longer. Our joints aren't lasting as long as our the life expectancy is. So arthritis, again, is that term we use as pain and development of instability in the knee, or pain in the knee as a result of the joint cartilage starting to wear itself out.
What are some of the common over-the-counter drugs that people can take if they're going to go play golf but they feel like they have pain?
Sure. So simple anti-inflammatory medication goes a long way. People take that for granted. Aleve, Motrin, ibuprofen, those are all the standard over-the-counter anti-inflammatory medications that do provide substantial relief for arthritic symptoms. I'm a huge advocate for some athletes taking an anti-inflammatory before a big event. If you know you have a big golf tournament, if you know you have a big tennis tournament, taking a prophylactic kind of Motrin or ibuprofen is totally reasonable and safe to do, as long as you take it with food in your stomach, as long as you stay hydrated. Those are great things. Icing goes a long way too. If you're playing a high-level sport, as soon as you're done, I'm sure you see on the NBA, all those players slap ice on their joints as soon as they're done. That's what we should be doing too. And even in the recreational kind of weekend warrior athlete, icing your joints down as soon as you're done after a high-impact sport. For patients who can't take oral anti-inflammatories, there's a lot of patients in this area who are on blood thinners, so taking oral anti-inflammatories is not a good option. Voltaren gel is an amazing over-the-counter anti-inflammatory cream. You think about it as Motrin in a cream form almost, and people can rub it all over different joints, and it helps with a lot of their ailments.
Now, if you have basically, take me, if you have basically, say, you're an Eliquis. Mm-hmm. Now, can you get tramadol with Tylenol?
So tramadol and Tylenol are more pain medications. They're not anti-inflammatory, so it is safe to take those medications on a current blood thinner regimen.
Tramadol.
Mm-hmm.
Okay, that base it's not anti-inflammatory.
It's not. It's a low-dose pain medication.
Okay, so we have 2 more minutes. We have 2 minutes. All right, Doc. Tell me something else about what you feel the future is for you here in Boca, in West Palm Beach,
No, so I think the one thing that's unique for me is I'm bringing the more modern, new techniques to this area. I mean, I've been seeing lots of patients now for almost 2 years, and I'm seeing a lot of old school techniques in this area. And I think there's a lot of me being one of the newer, younger doctors bringing these newer, modern techniques to the area. I think it provides value. Specifically, one that I like to spend a lot of time on is, again, we kind of talked about before, is ACL injuries. I do a lot of what's called Quadriceps tendon ACL reconstructions, which is more of a new modern technique. It's also called the all-inside technique, which is more minimally invasive, smaller incisions, using more innovative fixation techniques, and we're getting better outcomes with that. I think things are changing, and I'm kind of on the forefront of that.
And you're taking all insurances, am I correct, Doc?
We take a majority of insurance, almost all insurances.
So call the office. If you're in Medicare, he takes Medicare. I know he takes Medicare. He takes straight Medicare. He might take a lot of the HMOs, Medicare Advantage patients. He also takes PPOs. So call the office. Let them ask the girl what kind of insurance you take. Come and see him. You've got to get either an opinion, a second opinion, third opinion. Before you do surgery, I strongly recommend you see Dr. Brandon Shallop, either at one of the 3 centers, Wellington, Boynton Beach, or Lake Worth. Doc, it's fantastic having you. I want you back.
This is great. I appreciate your time and spending the time. This has been fantastic. I really enjoy it.
Thank you.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met. And I never worry. I hope you never need a nurse to come to your home. But if you do, tell your doctor, I want